Denise Brock, and I am the Operations Director for GRACE, the Global Resource for Advancing Cancer Education. And we're going to talk today with Jared Bigman and talk about his journey with clinical trials and his cancer diagnosis. Jared, can you introduce yourself?
Yeah, my name is Jared Bigman. I was diagnosed with non-Hodgkin's lymphoma back in September of 2012, and I live in Orange County, California.
So you were diagnosed in 2012. Can you tell us a little bit about your diagnosis and what your cancer journey's been like?
Yeah, sure. I was diagnosed while I was in college. I didn't have any real major symptoms other than a skin rash that had developed on my head. It spread over time. I saw a dermatologist. She couldn't get rid of it with any topical creams. So she got a biopsy that revealed a systemic lymphoma. And after biopsies and imaging, I went through immediate treatment after that.
Now you're considered part of the AYA cancer community. Can you explain what that is a little bit?
Yeah, so AYA stands for Adolescents and Young Adults with Cancer. I have a kind of a sweet spot. This usually as for people between the age ranges of 15 and 39. There's a lot of cancer education resources around people, pediatric cancers, as well as the majority of the cancer population, at least for my cancer, is usually in their 60s. And so I feel as though this population usually isn't given a lot of the resources needed to be prepared, to understand really the intersection of cancer and clinical trials with the rest of life that comes with being an adolescent or young adult. So, AYA cancers are only 5% of cancers diagnosed in the US. For my case, I'm an exceptionally rare non-Hodgkin's lymphoma diagnosis. It only impacts people in their older age generally. And so there are usually unique either biological or genetic features that result in cancers being detected.
So let's talk sort of around the life circumstances for the AYA population and things that set them apart from an older population. Maybe you can talk about when you were diagnosed and how hard it was to get a correct diagnosis. How long did it take to actually get to that diagnosis? Go ahead and tell us a little more detail about that, if you don't mind.
Yeah, it took a couple months to troubleshoot and try some different treatments just for the rash itself. But once I had the lymphoma diagnosis, it took, a tissue biopsy, a bone marrow biopsy, and a PET scan to actually give us the type and the other information that would really reveal where the cancer was, how much there was, and all of that. I think being in between not quite pediatric and not quite, full adult or being a younger adult was a little difficult. My parents were very involved in a lot of the doctor's visits and treatment evaluation of the different options I had that were given by my initial oncologist, as well as their desire for us to consider second and third opinions from other oncologists was something that was very important to them, and something I wouldn't have known about had I gone about this on my own, and also something that I think is important for AYA populations to consider is, normally in my experience, clinical trials are open to all patients who meet like a very specific criteria of diagnosis, state, and treatments they may have tried before or not tried before. Age is not always a consideration. It's sometimes only 18 and up. And so that is a benefit for many AYA populations. I think when it comes down to trying the initial treatments that are prescribed by your doctor, and if those first or second treatments aren't effective, determining if clinical trials are an option for you or not is really important.